You're listening to Beat Autoimmune and Thrive, the podcast all about reversing and preventing autoimmune conditions so you can live your most vibrant life as soon as possible. We talk about autoimmune root causes, actionable solutions, and inspirational healing stories. I'm Palmer Kippola, and I used to have MS. Today, I'm an author, a speaker, a functional medicine certified health coach, a pickleball player, and nature lover who's helped thousands of people reclaim their health and their best lives. Let's dive into this episode. There's one more big one that I want to touch on, and that's Lyme. So this is something that I feel like a lot of people miss. A lot of people who come to me or us and they say, I've already been tested and I'm fine. So why don't we start maybe with symptoms, because there are so many co-infections. It often presents in different ways depending upon the actual infection that's going on. And it's a constellation of symptoms perhaps. And maybe, there's classic Lyme, but there's all these co-infections. So maybe you can start at the top with Lyme, with what are people experiencing, and then maybe break it into each of the co-infections, the big ones, so that we know at least what our usual suspects might be.
Yeah, the 3 Bs, Borrelia, Babesia, and Bartonella are kind of the most common, although I think there's some others that are quickly gaining speed and getting right up there. Lyme is also really tricky. It's kind of in that same class as parasites to me. And they are parasitic. The organisms are, to some degree, more or less parasitic because they're eating your nutrition to survive. Like Borrelia eats collagen. It eats your collagen. It's its preferred food source. So it is a clinical diagnosis. Lyme disease really is a clinical diagnosis at the end of the day, and you really want to see a Lyme literate physician who recognizes the symptoms. And I think you also, this is my preference, but I think you also really want to see someone who is not going to overlook the other things like gut. A lot of times Lyme doctors only do Lyme. And so someone might have this happened to me as a doctor. I had a patient with just a raging candida overgrowth, and I was treating her for Lyme and she wasn't getting better. And we had to go back. And she was one of those people that wasn't complaining of gut symptoms. So don't forget that where we started with diet as the foundation and gut health as how you absorb nutrients and how you detox toxins really needs to be healthy before you dive into treating these other things. So Lyme disease is also confusing to the patient because when you read Lyme disease, what that originally meant was Borrelia burgdorferi. That's what originally coined the name Lyme disease for Lyme, Connecticut. It no longer really means that when doctors are speaking to each other or to patients. Like when I say Lyme disease to a patient, I really mean Borrelia plus any other co-infections that might be present, because the symptoms that the patient experiences, like you said, are a constellation of what happens when all of those things are in the body, in their favorite little niches, doing their favorite thing, eating their special nutrients. And they also all sort of help each other survive. They don't tend to compete because they live in slightly different areas of the body. They use slightly different nutrients. So the symptom picture is huge and wide ranging and can really be anything. Lyme disease is called the great mimicker because it mimics almost every disease. But I would say the biggest ones are if anyone has a diagnosis or symptoms of a diagnosis of MS, ALS, Parkinson's, rheumatoid arthritis, or any kind of joint arthritis, especially where the symptoms roam around from joint to joint. Those are big ones. Those are big suspicions. And if those symptoms are paired with fatigue, bone-crushing fatigue that comes and goes, physical weakness, lowered exercise stamina, those are the really kind of classic big ones. Now, there can be a whole lot of other things. Like, I'll give you an example. I had a patient this year who came in and her only complaint was complete and utter intractable insomnia. Like she couldn't sleep, not 1 hour at night. She would just lay there. She took everything known to man. She was a very high strung, stressed out person. And she had had one bout of insomnia similar the year before, took some prescription meds for like a week. It went away and she forgot about it. And then it came back and it just wasn't going away. And so if any of you have ever not slept, you know how you feel when you don't sleep for days on end. It makes you kind of crazy. And when we finally did a Lyme test on her, she not only had Lyme, but she had really, really elevated Bartonella. And she also had pretty severe anxiety. She was an anxious person anyways, but her anxiety had started to reach the level of panic. So the reason I mentioned this case is it's a little unusual because she wasn't particularly fatigued. She was more tired than she normally had been, but that wasn't her presenting a complaint because she was really running on adrenaline. She was such a high functioning goer, doer, constantly doing things that she was just running on adrenaline. I think her physical body was actually very tired, but she wasn't feeling it. So it was a little bit of a strange case, but it was one of those instances where we tested her adrenals, we tested her gut, we did every kind of test known to man. And we only waited on the Lyme test because she was very against it and thought, I don't have Lyme. That's not what it is. And so we waited until the 5th or 6th or 7th test to do the Lyme panel. And turns out that's what it was. That was the main thing. She had some gut dysfunction and some other stuff going on too. But I see a fair number of cases like that where people will come in with 1 or 2 sort of weird symptoms that came on suddenly, or they maybe had a bout of it once a year for 5 or 10 years, but it wasn't debilitating. And then something shifted in their life, some major stressor happened, and suddenly that symptom or symptoms just didn't go away, or the time between the bouts got less and less and less. And that's a sign that the immune system is just breaking down. It's becoming more and more depleted, confused, overburdened. So yeah, it really can be almost any symptom, especially if it's strange and you haven't been able to figure out any other reason why that thing is happening. Yeah. The other big one that we've seen recently is any nerve tingling. So even if it isn't a full diagnosis of like MS, tingling in the fingertips, weakness in the muscles, shooting electric sensations, that can also be mycotoxins, but chronic stiff neck or neck and back pain, and any kind of headaches, especially migraine level headaches that come and go in any part of the head, are big signs, especially when things come and go. That's a big sign. When people have really deeply chronic Lyme, they often hit a phase where it doesn't go away anymore. But in the history, you'll see that there are these bouts of like, oh, I'll just spend 3 days in bed for no reason. Like, I don't actually come down with the flu, but I feel like I'm getting sick. And I just am so tired I have to lay down. And then 3 or 4 days and they get up and they feel fine and they don't think anything of it. That is a very common symptom of Lyme disease.
Interesting. That is so interesting. And one thing that we've talked about before is that people who say, no, it couldn't be Lyme, they've never had the bullseye rash. Well, 60 to 70% of all people with Lyme disease, chronic Lyme, never get a rash. So it's kind of an urban myth, if you will, that you have to have this rash or you have to have been in, New England, where California is a huge community of Lyme infections, and the upper Midwest and Michigan and so forth. These are hotspots. There are more than 300,000 new cases of Lyme, and that's just what the CDC knows about every year, right? But arguably, it's way more common, and the fact that your doctor doesn't believe it may even be real, that chronic or persistent Lyme is a thing, is such a hampering thing to so many people. So this is where you guys, you got to just educate yourself about this. And let's talk about the symptoms of Babesia, because you haven't really touched on that so much. What would somebody be feeling that might lead you to think Babesia?
So Babesia is not one that I see as commonly, but it is one of the big things is air hunger, just feeling like you can't get a deep breath, but it's really almost like a hollow sensation in the chest. It's not really asthma, although it might get diagnosed as that. It's not really what someone would have with COPD. It's really a different sensation, and it often happens at rest. So it's not when you're exercising, that you'll just be sitting there relaxed, and suddenly you're like, I feel like I can't get a deep breath. That's air hunger. Babesia is related to malaria. So it affects the red blood cells and how the body carries oxygen. So that's a big one. Weakness, fatigue, also any cyclical, or which could be like only at night or once a month or every couple of weeks, of fevers, or just body temperature changes, like feeling like you're getting really hot at night, or night sweats is a big thing with Babesia. that can be alternated with chills. So people could be really cold and then sweating. Bartonella can also have intense feelings of cold, like where you feel like you're chilled to the bone and can't get warm, but less of the night sweats. That's much more Babesia or tick relapsing fever, which is huge in California. We actually are one of the biggest endemic areas for tick relapsing fever, which is a type of Borrelia, but it has slightly different symptoms. And one of them is this off again, on again fever that comes for no reason and often paired with night sweats and hormonal fluctuations.
Got it. Oh my goodness, this is so complicated. And I can see why you must work with somebody like you, Dr. Pedro. I mean, having worked in Maine for 5 years or so, I mean, you by default become a specialist in Lyme because you just see so many people presenting with this. And
Yeah.
I'm seeing more and more and more people presenting with this constellation of things, this amalgamation of mold and Lyme, and they tend to go together. And you think you just have an MS diagnosis, but honestly, it could be Lyme. It could be both. So the point is, you've got to dig deeper. You have to look at these. If you're not getting better, just doing the basic things, you have to follow these symptoms and get the test done, which is the next question on what are the tests that we're going to do that are maybe more, what's the word I'm looking for? More useful? I mean, the testing
help point you in the right direction.
That's right. Testing for Lyme has been notoriously bad or incorrect. So what are your top favorite tests?
Yeah, testing could be a whole talk in and of itself. And there's so many factors that go into what test to choose for which patient. Cost is the biggest one. So if cost weren't an issue for any patient I ever see, which is never the truth, but if it wasn't, then I would just have people do IGeneX. IGeneX is still the gold standard. It's a lab in Palo Alto. They've been doing Lyme testing forever. They have all different types of panels. The kind of broad panel that gets everything you really need, and it's not the biggest one, it's not the smallest one, is around $1,600. And that's just what it is for, and then they have panels as high as $5,000. But
wow,
that mid-range $1,600 is about what you need for the co-infections you mentioned, the different types of Borrelia, including tick relapsing fever. And then there are other labs. Like I often start with a lab in New Jersey called MDL, Medical Diagnostic Laboratories. They're just a standard lab that does a lot of other types of testing. They do a lot of infectious disease testing. And they use FDA-approved kits, but they're older kits. They're not the newer ones. And so they do test for Lyme itself, for Borrelia. They test more bands, more genetic bands in the Western blot than the more modern kits do. Mm-hmm. It's not as sensitive or specific as IGeneX, but it's often covered by insurance. And so it's a cheap way to get some information for me as the practitioner. And they do a great thing at that lab. They give you index numbers. So even if your results don't pass that positive threshold to put it in the abnormal column, but it's just borderline, they show you the exact numbers of antibodies that you had present, which for me as a clinician is really helpful to pair with the symptoms. So I often start there. And then there's also a whole host of others. So Vibrant Wellness has a great finger stick option, which in times of COVID has been super useful.
Perfect.
Yeah, where you get a finger stick kit at home. It's been shown repeatedly to be as effective as a blood draw. And it's really reasonably priced, and it's right up there with IGeneX as far as sensitivity and specificity. And it's only $400 for a complete panel. It doesn't give you a full, complete look at all the co-infections. Some of the co-infection testing is only done through PCR, which isn't great. It's not the greatest way to find things, but it's pretty good. And for the cost, it's a great place to start as well. And they give you actual numbers as well. So even if you're subclinical threshold, but borderline, that might be positive with your symptoms. And then there are a few others. The other one that I've used periodically that is the same technology and science as IGeneX, but about half the price, is a place in Minnesota called Infecto Labs America. The funniest name ever. They do a great thing in that lab where they can tell you if it does come back positive, they can tell you if it's a recent or an old infection based on the types of white blood cells that are highest in your body. So that's a great addition. And that one's about 875 for that, roughly the same panel. So there's options out there, but again, it really comes down to a clinical diagnosis. And the one thing I want to mention before we leave the topic of Lyme is Chlamydia pneumoniae and Mycoplasma pneumoniae, which are tick Lyme co-infections. But for any of you who might be listening who've been down this road already and you've been through Lyme testing and or treatment, and you're still not getting better, or there's still some symptoms that just won't go away, particularly fatigue or residual pain, Mycoplasma and Chlamydia pneumoniae are two organisms that are carried by ticks. They also cause walking pneumonia in and of themselves. So many of us have been exposed, and a lot of us have antibodies naturally, and that's normal and fine. But if you run antibody tests and those antibodies are elevated, and you have Lyme-like symptoms, but maybe you've treated that and you've treated all these things, you might be diagnosed with post-Lyme, what do they call it? Post-Lyme syndrome, which is really caused by the treatment, because the treatments, especially antibiotics, deplete the system so much that there's a lot of rebuilding that has to happen, especially of the mitochondria. But Mycoplasma pneumoniae and Chlamydia pneumoniae get overlooked a lot. And Chlamydia pneumoniae, one of the hallmarks is exercise stamina threshold. People can only go so far, walk so far, run so far, exercise. And if they go beyond that point, they'll crash for 2 or 3 or 4 days and can't get out of bed. And it's literally because you've used up all your cellular ATP, the energy molecule in your cells, because that organism eats ATP. So that's really a classic hallmark. And it's one of the most common organisms in chronic fatigue, like if someone has a diagnosis of chronic fatigue. And the great thing about Chlamydia pneumoniae, if there is a great thing, is it's really easy to treat compared to the others. So if it is present, it's often miraculous. Like even after just a month, people of treating it properly, people will feel infinitely better. And if it's part of a larger load, even just getting rid of that one will also make people feel better. And it'll free up your cellular energy a little bit.
Okay, so you've mentioned something that we have to know. What is it? What is this one thing that you use that could be the holy grail for people?
Well, it's a constellation of things, but with Chlamydia pneumoniae, there's a couple of different things you want to support. There's more than one way to do it, but you want to support and rebuild the mitochondria. And you can do that with free-form amino acids. You can do that with various different kind of histamine blocking things like quercetin, rutin, those sorts of things, bioactive carbon. There's lots of ways to do that. But surprisingly, one of the easiest ways to kill Chlamydia pneumoniae is those berberine compounds we talked about earlier. So I often make up herbal tinctures for people. So there can sometimes be residual lung involvement. If people still feel like they're having breathing difficulty in addition to the fatigue, then I'll use different herbs. But I use Oregon grape a lot, just plain old Oregon grape root in tincture form, with other herbs in pretty high dose for usually about a month. And almost always after a month, you can clear that infection, maybe 1 to 3 months, depending on the severity. But I get excited when I see that one because I'm like, oh, it's so easy compared to the others. And it often makes a big difference in how people feel. And then they have the motivation to keep going. Because when you're just that tired all the time, it's really hard to feel like anything's ever going to help.
Yeah.
So that one is a big one and relatively easy. Mycoplasma pneumoniae, on the other hand, is very tenacious, very hard to completely eradicate, and very, very common. I've seen a ton of it this year in California. Last year, there was a lung infection that went around that I think was mycoplasma, because I've had a lot of patients come in the last couple months who are still having respiratory problems from then. They said, like, I got this lung thing, or even I was diagnosed with walking pneumonia, and I took some antibiotics and did this, and I just still feel like I can't breathe. And when that's the case, getting rid of that initial lung involvement is actually, again, pretty easy. There's a great herbal tincture lung formula that I use that I can tell you if you want. It's just a combination of lomatium root, pleurisy root, osha, yerba santa, and elecampane with a little licorice. And that is like miraculous for lung issues of any kind, even just regular old walking pneumonia. But the tricky thing about mycoplasma is it gets into the joints and the red blood cells, and it eats up our heme ring, the iron ring that's in the red blood cells. So it can cause your red blood cell markers on blood work to look very strange, and your iron levels to be very strange. They don't quite match. And it has a lot of the same symptoms as Borrelia. So joint aches and pains. There was a study I read recently that some large percentage of people with rheumatoid arthritis, like actual positive RF factor, have chronic mycoplasma. And also, interestingly, one of the biggest treatments for chronic rheumatoid arthritis is what's the now I'm forgetting the antibiotic that they give to everyone. I'll think of it in a minute, but it's an antibiotic that they put people on long term, and it really, really helps with RA symptoms. And my guess is it's also one of the antibiotics that's used in Lyme treatment. And my guess is what it's really doing is killing the spirochetes and or mycoplasma that's in the joints and doing a lot of other damage along the way. But mycoplasma takes, 9 to 12 months to really get rid of, to really, really get it out of the body, because it's tiny, 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 tiny. 5,000 mycoplasma can fit into one red blood cell. So they are so much tinier than any other bacteria. And it just takes diligence and patience and time. And if everything else has been treated or you're just not getting better, that is one that you definitely don't want to overlook.
Well, and you're so right. And I love that you're setting expectations with how long it takes to eradicate some of these things, because I find, one of the reason I don't like the word patience, because I just don't, but we are required to have patience. I think that's how I like to use that interpretation, is that it's just going to take time. And I see mycoplasma when people are bedridden. I know people who have been in bed for 7 years with 7 autoimmune conditions. This one woman who was just down and out and left to her own devices to figure out how in the world, what was going on, right? And at the root of all of this was a mycoplasma infection.
Yeah. And it is just so common because so many people get walking pneumonia and they rarely test to see which organism is actually causing the walking pneumonia. They just send you home with some antibiotics. And so you may have just been in a room with someone who had it and you didn't actually get sick, but you were kind of inoculated. Your body dealt with it just fine, but it's in there. And then if you hit a really stressful moment and your immune system is depressed, it might just start to replicate. So that's the thing with all of these organisms, and particularly Lyme. People think that, the term Lyme disease in general causes so much fear and irrationality and just craziness because it's such a loaded term. And people think if you have Lyme disease, that's it. You're done. That's the rest of your life. There's no hope. And it's really not true. And if there's one thing that I try to tell people all the time is Lyme disease is just a term that we use because it's easier than saying all the other words that we would need to say to indicate the same thing. But really all it means is you might have been bitten by a tick when you were 15 and now you're 45 and you didn't have any symptoms until maybe you hit 40, or women in menopause is often a common time. And it's only because your immune system has slowly lost its resilience over time. And that thing that was there that was not causing any problems now suddenly is able to come out and play and replicate and, eat your collagen tissues and whatnot. But the real hallmark and underlying foundation of getting over these things is rehabilitating your immune system. Getting your immune system back up and running the way it was when you were 15 or 20 or 25 or whatever, so that it can deal with these things in a normal way. It's just become overburdened and confused, and it doesn't always work. But my hope is that by explaining that to people, it's less scary. It's less daunting. It's really just an immune system confusion, overwhelm. And if you slowly take the things out of the way that are overwhelming the immune system, it will do its job. It will come back and it will be happy and it will be healthy. It's just finding those things and then applying the proper protocol for you as an individual to get rid of them. And it is complex and it does take time, but it does work. And it's really not that scary. I try to tell people to look at it as an adventure.
I think that's such a beautiful way of framing it, because, look, you've got chronic Lyme. It's not a surprise. I have chronic Lyme, no surprise. I don't have symptoms, right? It's because my body is able to manage it within the context of how I live my life. I mean, I live in such a way that I try to do what I can to, help the terrain of my body fend off things as it can, but it's a constant. I mean, health is not, you're done. Like you reverse something like MS and you're done. No,
Yeah.
I mean, it's just an ongoing, it's a practice. You have to live in such a way that you make yourself as inhospitable as possible to these microbes, but you treat things, as you need to, and as you're experiencing symptoms. And then as you, peel back the layers of the onion and, follow the symptoms, get the testing done, do the treatment, stick with it for a long enough period of time, take enough of the dose for a long enough period, right? And you start to lower that immune burden, if you will, where it can all of a sudden just, be rehabilitated, like you said.
Yeah. And you want to find, if it's a really chronic thing, you really want to find a guide and a helper that you have rapport with, that is going to teach you skills too, because I think the reason we do these interviews and that you have the teaching academy is that I don't want my patients to be dependent on me for life. That's not my goal, is to have them have to see me forever. I want to teach them how to live in such a way, the water they drink, the food they eat, when they go to bed, like all of the daily life habits. I want them to learn and live in such a way, or learn to live in such a way that these things don't come back. I'm only here to help teach them that and to help give them actual treatment when they're sick or if they happen to get sick again. But really, the bigger role is teacher. It's really teaching them what I can so that people learn to live like you have. Like you said, you've learned to live your life in such a way that these things don't hinder you or keep you at bay, keep your life down in any way. And that's really what it's about, is finding someone to work with that you trust, that you have rapport with, that you're just going to stick with for, 6 to 12 months with these chronic illnesses. And then you've got someone to go back to that knows you, knows your history, if you do get sick again.
Yeah. Oh, such beautiful words and such a perfect place to pause this. Thank you so much for sharing your wisdom, the expertise. I feel like it just comes through that you have learned over the years, both with yourself and your patients, just this whole world of hope and real hope, not just, pie in the sky hope, but actually people getting better. And that's really the holy grail, is getting back to your best life.
Yep, absolutely. Thank you for having me again, Palmer.
Look forward to it the next time. Thank you.
Bye.
Thank you. And that's a wrap. Thanks so much for tuning in. If you enjoyed this episode, be sure to subscribe, share it with your friends and family, and if you feel inspired, please leave a quick review so other people can find it too. Now, if you want to beat autoimmune and thrive, make sure you sign up for my free video training at freeautoimmunetraining.com. That's freeautoimmunetraining.com, and watch the first video right away. Take good care. Bye for now.